I think that we're all eco-heroes. All of us who've been working on this. In Nova Scotia, every year they have an annual award, the Nova Scotia Environmental Network, and it's called the Eco Hero Award. So when they opened up the nominations this year, one of the nominations, it usually goes to a group, and so what happened this year, it's the whole movement to stop shale gas got the award. And because there's no one group, and it's the same here. You've got all these groups, all sorts of different groups, people who aren't even in groups. Everybody's doing their little bit to make sure this doesn't happen. And I think that when you look at the unevenness of the forces here, I think you're like us. There's no one in Nova Scotia paid to do anything, any of this. It's all volunteers. It's all people who are putting a huge amount of time and energy into learning, into speaking out, into talking to their neighbors, and just doing what needs to be done. And I think that it is heroic, and I'm very glad to be able to be in Taymouth tonight. So thanks for inviting me. So what I'm going to do tonight, and so shale gas, like Peter said, it's a lot of different issues, and mostly we think about it as a water issue. That's been the big issue, and I'm not going to talk about that very much tonight. It's the industrialized rural areas issue. It's a sort of communities issue. It's it's an economic issue. It's a climate issue. It's all those issues, and it is a health issue. And so I want to take you through quite a bit of information tonight to show you how it's a health issue and where that leads me purely from a health perspective, and when I talk to people who are health professionals, where it leads in terms of hoping that they can take a position. So next, okay. So you guys probably know this beginning stuff, but I find it's useful to set like a foundation. So this is what we're going to go over. So what's different about shale gas and this style of fracking, not the traditional fracking. What we know about health risks and impacts, what we don't know, and where that leads us. Is it time to develop, or is it time to press the pause button? So, as you know, I mean, I didn't revise it for you, but it's okay. So the scale of shale gas is really unlike anything we're familiar with. It expands over the landscape. There's well pads, frequently scattered around, and each well pad, contains wells which flare off. They contain the wastewater pits. For every, I think, 5 well pads, there's a compressor station. There's pipelines. There are all sorts of things, and all of those things form part of they have an impact on health and on environment and a whole lot of other things. Okay. So this is from Arkansas. This is how dense the wells are in Arkansas. And I don't know how well you can see it, and I'm just looking for the cursor. There we go. But in here, there are little school buses. So the green and yellow, green are wells that are fracked, yellow haven't been fracked yet. Blue are what they do with the waste. So something is called a land farm. And what a land farm is where they spread the toxic and radioactive drilling muds. So when you hear the land farm, sounds very benign, right? Doesn't sound like a problem at all. Well, that's what it is. And we'll get to whether anybody knows what the long-term effects can be. And then in here, there are school buses. They're kind of blurry because this came off the internet, but these are all school buses, and those designate cities with schools. So this isn't happening in the middle of nowhere. This is happening right in communities, very, very dense. The buses don't come out too well, do they? But they're there. It's okay. Trust me, they're there. So this is sort of a basic little sketch about the difference between traditional gas development and the new unconventional shale gas or coal bed methane. So in the old one, right, they drilled into sandstone. Sandstone is porous, okay? So what that means is once they found a pocket that they could tap, I mean, no, this is not your civil engineer's definition, okay, but it's basically right. And they created a pump. The pump created pressure to pull the gas out. The gas would flow. It would flow for miles and miles and miles around because the rock is porous, okay? So that gives a very different character. With the shale gas, as you know, it goes down and then it goes horizontally. I just read a comment from the industry that said, why are they making such a big deal? The only thing that's different is that we're turning the drill and going horizontally. Well, I'll show you some of the ways that it is different. So in addition to turning the drill and going horizontally, the shale layer isn't porous. It's dense, and the gas is trapped in tiny little fractures that are already there in the shale. The only way you can extract gas from shale is by fracturing that shale. The only place the shale is going to be released is where you fracture. Okay, so it's not going to be flowing. So what that means is you've got to go down, you've got to go out, not this little bit, but up to a mile, and now it's starting to be even more than a mile. It's fractured with, it takes very high pressure to fracture shale. It's very dense, it's very hard. It's not sandstone. The little bit of fracking that happened at the bottom here was at a much lower pressure, okay? So you've got high pressure, you've got a long drilling, you've got high pressure to fracture. You need fracking chemicals, you need slick water to make the drill able to penetrate through a long, long, long distance of very dense rock. So that's where you get your fracking fluids, which are quite different than what's used in traditional oil and gas. Okay, so each of these are adding up. So when we're going to look at the impact of each of them. And then obviously the distance means that the amount of water you have to use is going to be hugely more. The amount of mud that you pull out is going to be hugely more. And everything that comes back up is going to also contain toxins that are contained in the shale layer. So this is a key one. At the beginning, I think a lot of us thought that the main danger was the fracking fluids, but that's only a piece of it. The other piece is that there are toxins in shale and they come back up, and we'll look at what some of those toxins are. So they become part of the contamination that's being released. So that's another big difference. Okay? So now you know that there are more than just the changing of the direction of the drill. So that's kind of your summary. So we've got the directional drilling, we've got slick water, we've got the toxins from the shale, and we've got the mammoth scale. Because the other difference is with the gas in sandstone and it was porous, it was coming from quite a long distance. Okay, so you didn't need as many wells. With this kind of gas, you need a lot of wells because you're only going to get the shale or the gas from where you fracture. So, you know, as Tony and Gravia said, if the gas is everywhere, you drill and frack everywhere. So that's why you see those networks of well pads, right? Because they're the distance of how far they can frack. And you have usually 6 wells on a pad going in different directions. So the whole structure, the whole way this industry works is different than conventional oil and gas. Okay? So that's, and all of those differences relate to the health impacts. So there are multiple sources of exposure from toxins and how, so we're going to look at what are the toxins and then how people can be exposed. So this is just a little summary and I'm going to go through it more in detail. So we have the fracking fluids, the potential exposures. I'll detail this more later. This is just to give you a little overview. So you can be exposed when they go into the air, when they are volatile, and the ones that are volatile go into the air. Some are water soluble and can go into water, whether it's above ground by spills or whether it's underground from contamination. There's the toxins that are released from the shale, and again, they can be in the air, they can be in the water, and they can be a source of contamination if they're stored underground, like in the injection wells. Oh, that was the other part, the other blue. The blue wasn't just land farms, it was injection wells, which is a industry-preferred method of getting rid of toxins, which is essentially to hide them underground. And those injection wells have been linked with earthquakes. definitively by some very reputable bodies, not just hysterical environmentalists. So, so then we have the wastewater, which includes the toxins from the shale and the fracking fluids, sitting around for quite a long time, and we'll talk about that later. We have flaring wells, so there's air contamination. So we're looking at, so what are the routes of exposure? Because it's not enough to say that there are toxins used. We have to show that people can be exposed. So these are some of the ways people can be exposed. There are compressor stations, which have been shown to emit a lot of volatile organic compounds into the air, and also very noisy. The condensate tanks also have a lot of leakage, so there's chemicals in the air. Pipelines, they've documented a lot of leakage. A lot of it's into air. Some of it can be into the soil. Some of it can be into surface water, rivers, streams. Diesel fuel combustion, which is another air pollutant, comes from the trucks, and we'll talk about how many trucks there are, and the pumps. You know, you've seen the pictures of the series of pumps. And then, you know, leaks, spills, accidents, overflows, which could result in either air, water, or soil contamination. So there's a lot of routes of exposure. And this is this is what leads us, I think all of us, to say the issue isn't just fracking. You can't just narrow it to fracking. You can't just talk about how you're going to change fracking. You have to look at the whole industry. That's one of the big fights we've been having in Nova Scotia, is that the government decided to review fracking. We're saying, no, you've got to look at the whole thing. You've got to look at the whole industry and all of the impacts of the industry, not just one piece of it. Of course, from the industry point of view, they would much rather narrow it. And then they could say, oh, well, that problem wasn't caused by fracking. That was caused by a faulty valve. So, you know, they can just split it off. So if we talk about the whole thing, it's more accurate. So, and because I'm talking from a health viewpoint, the issue can't be narrowed to fracking. And the different risks come from this kind of gas, come from all the stages. And as well, we have to talk about the scale. So that's part of the picture, because the health impacts are cumulative. They mount up. You don't, the way things are usually regulated, it's on a piece-by-piece basis. So is this one well going to, when it flares, going to emit, you know, an acceptable amount of whatevers? But if there's 1,000 wells emitting, that's a different situation. Or is this amount of wastewater, it really comes out with wastewater. If we allow this amount of wastewater with radioactive materials, which I'll get to later, to be released, you know, if it's only 100 gallons, that might be safe. If it's 1 million gallons, if it's 6 million gallons, you know, it's a different standard. It has to be looked at cumulatively. So, okay, so here's like a really mini course on environmental toxins. So you have to look at how we're exposed to toxins. There's three main ways: inhalation, ingestion, so eating or drinking, or absorption. So some chemicals, not all, but are also absorbed through the skin. And I think we're finding out in the last number of years that many more can be absorbed through the skin than was originally thought. People, scientists thought that the skin was a barrier. It's turning out not to be a barrier for as many things. It is for some things. But when you think about drug patches, right, those are absorbed through the skin. A lot of other things are too that we don't necessarily want absorbed. So another piece of this about environmental toxins is how much, how often, and when you're exposed. So traditionally, toxicology has looked at, they say the dose makes the poison. If it's a big dose, it's a problem. If it's a little dose, it's not so much of a problem. So that understanding is also changing. So now we have an understanding, I don't know that it's completely accepted, but it's certainly much more broadly accepted, that chronic low-level exposures can have as serious impacts as one big exposure. And that's the kind of exposures we're talking about for people living around shale gas, right? It's going to be chronic low-level exposures. It also depends when you're exposed. So if they're vulnerable populations, so a developing fetus, a young child, is going to be more vulnerable, and I've got slides that explain that. People who already have asthma, for example, are going to be triggered by lower levels of air pollution than people who don't yet have asthma. So those are vulnerable populations. The elderly are often not as able to fight. Some of us don't define ourselves as elderly. That line is getting longer, farther and farther away. But whoever those elderlies are, you know, they are more vulnerable to a lot of toxins. So here's just a little bit about children. So this information comes from a group called the Pediatric Environmental Health Specialty Unit. It's a subgroup of the American Pediatric Society. So these are people who know what they're talking about. This is a professional organization. And they have a fact sheet, a 4-page fact sheet on children and natural gas, and particularly shale gas. So these are the points that they make, that children eat, drink, and breathe more than adults per pound. So a little child is going to be breathing more than per pound than we are as adults, which means they're going to be more affected by exposure to environmental toxins. Children have less developed, not completely developed immune system, so they're less able to break down toxins. So that's another way. So if they're exposed, they're less able to process and get rid of those toxins in their bodies. And there's what's called critical periods of development, or critical windows of development. The fetal development is one, young childhood, infancy, young childhood, and adolescence, actually sort of the puberty period, are all times when the body is changing rapidly, and when the body's changing rapidly, it's more vulnerable. There's different toxins at different times, so science has developed enough now that they know that, you know, at the 12th week of gestation, exposure to this particular toxin can create this effect. So, I mean, we know way more than we knew before. But in general, children and developing fetuses, infants, and young children are very vulnerable, much more vulnerable than adults to environmental toxins. So prenatal exposures in particular, these are some of the chemicals that are likely to exist in shale gas development areas. So benzene is the one that's very, very prevalent. It's from flaring gas wells. It's been found in contaminated water. It's one of the toxins that's actually released from the shale. So there's a number of sources from it. It's been used in fracking fluid. So prenatal exposure to benzene increases risk of childhood leukemia. Prenatal exposure to diesel fuel combustion products, and you know that there's going to be, there's from the trucks and from the pumps, I mean a lot of diesel fuel combustion products can lead to low birth weight, and low birth weight is considered an indicator of many health problems throughout life, including learning problems, including health, sort of physical health problems. Endocrine disruptors have very significant effects in very minute amounts. That's the key thing. People are actually it's just very recently that there's become more awareness of endocrine disruption, because I think it wasn't something that could even really be measured very much until fairly recently. There's actually a new act in the United States right now about endocrine disrupting chemicals, and it's coming out of the worries about shale gas. So endocrine disruption is one of those things that with prenatal exposures, it can lead to not only lifelong effects, but actually multi-generational impacts. I mean, this is amazing. It can actually change genes so that, and in a way that's carried over from generation to generation. So it can be very serious. And of the identified chemicals in fracking fluids, and I've got a chart later, 40% are known endocrine disruptors. So that's, you know, there's a lot of potential problems. So I said I'm not going to talk a lot about water, and I'm not, but I just want to make sort of a couple of points. One is that some water contamination is visible and some isn't. If you saw your water come out of the tap like this, and I hope that never happens, you would probably not drink it. But there are other kinds of contaminants that have been found in contaminated water in shale gas development areas that are odorless and tasteless and invisible. And then you really have problems because you don't know that you're being exposed. I mean, depending on what they are, you may have different problems, but we can't assume that it's always going to be obvious, and that's another area of risk. So I'm sure you're familiar with this, but this is sort of the one piece of information on water that I want to throw in, and not because water isn't important, but just because I think you know probably a fair bit on that. This was the EPA study in Pavilion, Wyoming. So what it started with is people had health complaints. They were starting to have a lot of health problems. People were thinking, you know, we didn't have these problems before shale gas came, and we think that it's you know, connected, and we think that there's something in the water. And they actually complained and asked for people to look into it for 7 years before anyone did. When the EPA did look into it a number of years ago, almost 4 years ago now, they told people they probably shouldn't be drinking the water. But they couldn't make any conclusions at that point. Obviously, they took it seriously enough that they did a 3-year study, a very elaborate study. They did water samples of the wells, and they even drilled, it was a number of stages, but they even drilled 2 test wells into the aquifer, so it wasn't just individual wells, but they went to another place in that aquifer, drilled 2 test wells, and they did testing in all those areas. And this is what they found. They found 10 compounds used in fracking fluids in those wells, including the 2-butoxyethanol, which is one of those chemicals that's very toxic in very small quantities. They found benzene at 50 times above the safe level for human consumption, and they found these other chemicals as well. And so benzene is a carcinogen. Some of these other chemicals are also carcinogens. Some of them are nervous system toxins. Some were endocrine disruptors. So, you know, this is fairly significant. And so what the conclusion was, they also looked at what wasn't there, because they were very smart about this and said, obviously, the industry will say you can't prove this came from fracking. And since it's underground and you can't like really prove, you can't get in there with a, you know, camera and prove it. So they tested for other compounds that might come from other sources, like agricultural sources. So they tested for that, and they didn't find any fertilizers or pesticides in the water. So they said this is not likely to have come from agricultural sources, because if it did, it would have had these chemicals. So the conclusion that they came to, hold on a sec, where's my little cursor? Basically, they said we believe this is consistent with migration from a gas-producing area. It's consistent with that. We believe that fracking is the likely cause. And that's about as close to saying it is the cause as any sort of scientist is going to get, because they almost can never prove sort of directly cause and effect. But so this is the study that the industry really doesn't like, because of course they've put all their weight on repeating over and over and over, there has never been a case of water contamination from fracking. Okay, so this one comes pretty close. The best line I've heard from the industry on this one was the EPA contaminated the aquifer when they drilled the test wells. So this is what it means to say there's never been a case. It means whenever we hear it, we're going to tell you it's not true. So Dish, Texas, this is a tiny community. I mean, you guys can relate to it. They're even smaller than you. 60 people, you know, in sort of pretty well the middle of nowhere. And there was a shale gas compression station built there, and people started getting sick. Some of the symptoms: severe nosebleeds, headaches, dizziness. 94% of the residents had symptoms. So they asked the company to look into it, and they asked and they asked and they asked, and finally the company did look into it, and they said, well, there really aren't any problems. So, and the Texas Commission on Environmental Quality wouldn't look into it either. So the town hired did their own quality testing. They didn't do their own, they hired a lab. And this is what that lab found out. They found the high levels of 15 chemicals. Benzene, again, it keeps showing up in all sorts of different situations. And these are air samples, right? So we're talking about air pollution here. benzene, xylene, naphthalene, carbon disulfide, again, with a number of different kinds of health effects, okay? And some levels 10 times the recommended level for short-term exposure, okay, and people weren't just being exposed in the short term, and some were considered high enough to be in immediate danger. So we all owe a vote of thanks to the people of Dish, and I know you had Calvin Tillman up here, right? Calvin was he was the mayor who called for those tests, right? And that was a wonderful thing that he did, because it was the first documentation, you know, sort of really elaborated documentation of air quality problems and what they were, what the chemicals were, what the levels were in a community. So, and so, yeah, so that was the conclusion from the report. No other facility with the capability to produce the volume of air toxins that were there. So, I mean, they were in the middle of nowhere. There wasn't any other industry, right? But, you know, you put that in a report so everyone knows that, right? So we can all rely on it. Although some of these chemicals are carcinogenic, it's really hard to measure sort of incidence of cancer because cancer takes a long time to develop, you know, some longer than others. So we don't really have hard data about whether there's increases in cancers in gas-producing areas. There's probably only 3 areas, Wyoming, Colorado, and Texas, where there's actually been shale gas development for long enough to know. There are actually some studies from traditional oil and gas that even show some increases. But this is what you would call preliminary evidence. You can't say, yes, this shows that cancers increase where there's shale gas. But what somebody decided to compare breast cancer rates in Texas in the counties. They have 6 counties that are gas development, really intense, they call them intensively drilled counties, with the rest. And so in those 6 counties, breast cancer rates had increased in, I don't know what the time period was. I assume it was the year just before that study came out. They increased. In the other counties, they were going down. So that's certainly an indicator that there needs to be more study, right? It tells you, it's a little red flag that says we better pay attention to this. This is there's only 3 published peer-reviewed studies. That means a study that's had to be looked at by other scientists before it's published in a publication. So a peer-reviewed study is at a higher standard than a non-peer-reviewed study. That doesn't mean they're all right, because sometimes you get conflicting evidence. But so a peer-reviewed study is considered much more solid. The EPA study will be peer-reviewed. It's in the process of being peer-reviewed. So that's another thing that the industry says, oh, but it's not peer-reviewed. Well, they said it the day it came out. Of course it wasn't peer-reviewed. It just came out. It wasn't yet at the point of being published. So, but this is one of the 3 studies, and this just came out a couple of months ago, March of this year. And this was a team of people from the Colorado School of Public Health. And they looked at air emissions, and they tried to look at increased risks in people within a half a mile of a gas well and farther than half a mile. So they found increased cancer risks. I wanted to change this, but I didn't want to open my computer and do it. But it's not almost double. It's actually 66%. So I'm exaggerating by saying almost double. So 66% is still pretty significant. So increased cancer risks and benzene, there's benzene again, was a major contributor. They looked at the different chemicals and which were the ones that were most likely sort of to increase the risk, and benzene was the one. And this was based on measuring what chemicals were found in the air in that area. Non-cancer risk is a term that's used by the Environmental Protection Agency. It kind of groups a number of illnesses, and I quite honestly cannot tell you exactly what's in it, but it's kind of this accepted term. There's cancer risks and there's non-cancer risks. So the non-cancer risks were more than double, and presumably that includes stuff like asthma, other respiratory problems. I don't know what other ones are in there. Someday I'll find out. And then they list the chemicals that were most likely to contribute to the non-cancer risk, and that was more than double. That was actually 2.5 times greater for people within a half mile of a well and farther away. And what the authors say is that they likely underestimated the risks because there weren't known toxicity levels for certain chemicals, for a number of chemicals that they knew were in the air, but they didn't have a way of quantifying how much risk that would create. And then other chemicals that they knew would be risky hadn't been measured. So it's most likely an underestimation of the potential risk. This is really important. This is the first study that's done this. The other two studies, one is an animal-human, it's got some case studies, and I'll talk about that later, and the other is Theo Colburn's work with the fracking fluid composition, which was the first one. So there's only 3 published peer-reviewed studies. There's also not very many studies on anything else about shale gas. In fact, one of the authors of some of the studies made a presentation to Congress recently, and he said the first published study, peer-reviewed published study having anything to do with shale gas was published in April of 2011. That's just over a year ago. So we're totally justified in saying, slow down. You don't know what you're talking about. Nobody knows. We don't know. But we have a reason to be worried.